Thank you, Mr. Speaker. Mr. Speaker, I have made the Minister of State for Community and Social Care aware of my intention to make this point of order. Mr. Speaker, in an answer to my written parliamentary question asking for the number of deaths that have occurred in child and adolescent mental health units since 2010, the Minister for Community and Social Care said that there had been only one such death recorded by the Care Quality Commission. However, FOI requests conducted by inquests have found that at least 9 young people have tragically died in England while receiving inpatient psychiatric care since 2010. In response to this research, the Minister stated in an interview with last night's BBC Panorama that he did not know how many children and adolescents have died in psychiatric units in recent years. This discrepancy between the government's account of the number of child deaths and the data collected by FOI requests raises some serious questions about how deaths in psychiatric care of some of the most vulnerable people are treated, recorded, investigated and learned from. Mr. Speaker, could you advise me if you've received any indication from ministers that they intend to clarify for the parliamentary record an accurate figure for the number of children who have tragically died in all NHS-funded psychiatric inpatient settings since 2010?
Really important questions are raised by this matter and the broadcast. They're not for me. We can't have question time on the basis of doing it through points of order. Seeing as the Minister of State is here and is apparently willing to say some words, we're happy to hear from him exceptionally. Minister of State Burt.
I'm very grateful, Mr. Speaker, you allow this, and I appreciate the honourable members giving me notice of this. There were some very serious questions raised by the Panorama programme last night. I've agreed to meet inquest Deborah Coles, the lady who put in the FOI request. There is a discrepancy in number. There are difficulties in definition in relation to this, but the present situation is not acceptable. I will look to find as quickly as possible a way of correcting the record as soon as we know exactly what the figures are and make sure that we have sorted this data problem out effectively for the future.